We're in the process today of doing liposuction to the upper, mid, and then lower back hip rolls. We're doing this under local anesthesia. We're going to make it as sterile as possible, which I think is very important. And she took some PA narcotics and Valium just to relax her. And she's also on the Nitronox system, so she can breathe in at her will if she needs to. Okay, we did a little bit of local here, and now we're going to inject quite a bit more local, infiltrate the underlying skin with a tumescent solution, and then we're going to do the vaser to break down the fat, and then which also helps a little bit to tighten the skin if you go a little superficial, and then also we will do the liposuction. So we made some small incisions here, and then we're going to start to infiltrate the tumescent solution, and it's starting to whelp up a little bit there. We try to do this really slowly because, you know, the patient's awake. Of course, if they're asleep, we can move a lot quicker when we do this. But this allows us to fill the area where we're going to do the liposuction, so it accentuates and makes it easier also for us to suction the fat out. And then there's a lot less bleeding when that's involved. Well, she seems pretty comfortable. Sometimes patients will fall asleep when they do this, but depends on individuals to individuals. So this is a part that's kind of the hardest for the patient. So we have to fill real slowly the area that we're going to be doing liposuction. So you can see now how everything is kind of like engorged with the fluid that we put in there. We're going to wait a few minutes, usually about 10 to 15 minutes, allow the epinephrine or the adrenaline to work. And then of course there's numbing medication, lidocaine, in what I just injected. So now we're doing the vaser ultrasound. And this will break up the fat. It will make it easier for us to remove the actual fat itself, especially in areas like the upper back where the fat is has more structure. It's less fluffy. It's a little stiffer. And now, you know, it's going in pretty easy in and out, but in a few minutes it's going to slide just like you're sliding through butter. And patient's pretty comfortable. I don't think she's not breathing in the nitrous, so I think she's doing pretty well with that. You doing okay? Good. You having any pain? Good. You fall asleep if you need to. And I always do this with my assistant, Nicole. And the reason the working hand is my right hand, but my important hand is this one right here, the left one, where I can feel how deep I am. So I'll know how deep that cannula is, make sure I don't go too deep. It's not a very hard procedure to do, but on the other hand, you can get yourself in pretty quick trouble if you don't know your anatomy and you don't know where the cannula is in reference to the superficial skin. So I always am very, very careful with this because, for example, underneath here we have the lungs, right? So, or the heart. So we don't want to cause any issues with that. You can see there's basically no bleeding that comes out of here. So there's small incisions and the adrenaline works really, really well. And this is a skin protector because this gets really warm. That's how it works with the ultrasound. So if we were just going in like this, it would kind of burn the skin all the way around it. So because of this little plastic gizmo here, it doesn't burn the skin. So it's very, very helpful. Now we're in the process, after finishing the ultrasound, the Vaser is to use these cannulas of different sizes to aspirate the fat out. Okay? It's been basically ultrasound, and so it almost comes out like a liquid. So we just put a few little stitches in all those little incisions, and then Nicole is putting on a little dressing on there, and then we're going to do the other side and we're all done.